Welcome. In this video, we'll be exploring Crohn's disease, a chronic inflammatory condition that affects the digestive system. We'll delve into what causes it, how it impacts the body, common symptoms, how it's diagnosed, and the various treatment options available. Join us as we unravel the complexities of Crohn's disease and shed light on living with this condition. While the exact cause of Crohn's disease remains a mystery, researchers believe it's a combination of factors. Genetics play a role, meaning a family history increases your risk. The immune system's response is also critical. In Crohn's, the immune system mistakenly attacks the digestive tract, leading to inflammation. Environmental factors such as diet, smoking, and certain infections may also trigger or worsen the condition. It's important to remember that no single factor is solely responsible. It's usually a combination that leads to the development of Crohn's disease. The pathophysiology of Crohn's disease is characterized by chronic inflammation in the digestive tract. This inflammation can affect any part of the gastrointestinal tract, from the mouth to the anus, but it most commonly involves the ileum and colon. The inflammation typically extends through all layers of the bowel wall, leading to thickening, scarring, and narrowing of the intestinal lumen. This can result in ulcers, abscesses, and fistulas, which are abnormal connections between different parts of the intestine or between the intestine and other organs. The inflammation disrupts the normal digestive processes, leading to malabsorption of nutrients and various gastrointestinal symptoms. Crohn's disease affects people of all ages and ethnicities, but it is more common in certain populations. The highest incidence rates are found in Western countries, particularly North America and Europe. It often diagnosed between the ages of 15 and 30, though it can occur at any age. There is also a slightly higher prevalence in people of Jewish descent. While the exact reasons for these disparities are not fully understood, they likely involve a combination of genetic and environmental factors. The signs and symptoms of Crohn's disease can vary widely depending on the location and severity of the inflammation. Common symptoms include persistent diarrhea, abdominal pain and cramping, rectal bleeding, weight loss and fatigue. Some people may also experience mouth ulcers, skin rashes, eye inflammation, and joint pain. In children, Crohn's disease can lead to delayed growth and development. It's important to note that symptoms can fluctuate, with periods of flare-ups followed by periods of remission when symptoms are minimal or absent. Diagnosing Crohn's disease involves a combination of medical history, physical examination, and various diagnostic tests. Blood tests can help identify inflammation and anemia. Stool tests can rule out infections and detect blood in the stool. Endoscopic procedures, such as colonoscopy and upper endoscopy, allow doctors to visualize the lining of the digestive tract and take biopsies for microscopic examination. Imaging studies such as X-rays, CT scans, and MRI can help identify complications like strictures, fistulas, and abscesses. The diagnostic process aims to rule out other conditions and confirm the presence of Crohn's-related inflammation in the digestive tract. Crohn's disease can be classified based on the location of inflammation in the digestive tract. Ileocolitis is the most common type, affecting the ileum and colon. Ileitis affects only the ileum, while colitis affects only the colon. Gastroduodenal Crohn's disease involves the stomach and duodenum, and perianal Crohn's disease affects the area around the anus. Knowing the location of the disease helps guide treatment strategies and predict potential complications. Treatment for Crohn's disease aims to reduce inflammation, relieve symptoms, and prevent complications. There is no cure for Crohn's disease, so treatment focuses on managing the condition and improving quality of life. Medications used to treat Crohn's include aminosalicylates, corticosteroids, immunomodulators, and biologic therapies. Nutritional therapy, including special diets and supplements, can help address nutritional deficiencies and support healing. In some cases, surgery may be necessary to remove damaged portions of the intestine or to treat complications like fistulas and abscesses. A multidisciplinary approach, involving gastroenterologists, surgeons, dietitians, and other healthcare professionals, is essential for effective management. Currently, there is no known way to definitively prevent Crohn's disease. However, certain lifestyle choices may help reduce the risk or severity of the condition. Not smoking is crucial, as smoking is a known risk factor for Crohn's disease and can worsen symptoms. Maintaining a healthy diet and managing stress may also be beneficial. Early diagnosis and treatment are important to prevent complications and improve long-term outcomes. The prognosis for Crohn's disease varies depending on the individual and the severity of the condition. While Crohn's is a chronic condition without a cure, many people can achieve long periods of remission with appropriate treatment and management. Recent research has focused on developing new biologic therapies that target specific inflammatory pathways. Scientists are also investigating the role of the gut microbiome in Crohn's disease and exploring potential therapies that manipulate the gut microbiome to reduce inflammation. Ongoing research is crucial for improving treatment options and ultimately finding a cure for Crohn's disease.